الدكتورة شيرين حسين اللي هي أستاذة سياسات الرعاية الصحية والاجتماعية في قسم أبحاث وسياسات الخدمات الصحية كلية لندن للصحة والطب الاستوائي في المملكة المتحدة. دكتورة شيرين، رح نسألك سؤال عن الظروف الاجتماعية والاقتصادية وتأثيرها على الصحة في المنطقة العربية. ما هو برأيك أهم المحددات الاجتماعية والأكثر إلحاحا للصحة في المنطقة العربية اليوم، وكيف يمكن معالجتها بفعالية أكبر من خلال السياسات الصحية؟
السلام عليكم. شكرا جزيلا. I'm going to speak in English because that's easier for the translator. So I understand Arabic, but I'll stick to the English. So I'm going to take, well, thank you for that important question. And we can spend hours talking about different social determinants of health. But I'm going to focus on equitable social determinant of health. And I will focus on two aspects, which is age and gender. So we know that the region is still young, but we are luckily going older fast. And Dr. Rashidan have shown a slide about healthy aging. But unfortunately, the region, so the whole world is going older, and the region is one of the fastest regions to go older. So we know that in 1 or 2 decades, by 2050, there will be over 71 million people over 65. And the transition in the region is happening much faster than what happened before in other countries in Europe or in North America. But we're going to age fast, but we're also going to have more years of ill health while we're growing fast. And we are thinking about indicators and measures of health that excludes measures for older people. So if we look at the existing indices and the goals that we're working towards, for example, the Universal Health Coverage Index, you find it that is very skewed to younger people. That's across the board, not only in the region, but because the region is coming into this quite fast, we need to pay particular attention to older people. So at the moment, we see a lot of exclusion and unmet health and care needs among this population. So I lead a network called the Minara Network, and we've been in collaboration with the WHO over the past year or so, looking at evidence to examine the unmet needs of older people in the region. And of course, the first thing that we faced and struggled with is the lack of data, which Dr. Rashidan mentioned, but also the lack of indicators that are specific for older people. So we have some good initiatives coming in the region. So I know that Lebanon and Egypt are now piloting household surveys that are focused on older people. So this is really great news, and we are getting traction into that. But the existing evidence that coming from small surveys or studies show that unmet health and care needs can go up to 80% among older people, particularly in situation of emergency or difficulties. We know that the structure of the norms and culture make older people maybe say we're not important, sacrifice their health. There are financial pressures, and then you prioritize across the generations. So I really urge that we take a life course. So when we talk about NCDs at younger age, we know that this will accumulate at older age. And we know that not only the disease burden at old age is an issue, the caregiving burden, because when we think about the health and care ecosystem, and I intentionally call it ecosystem because I'm not thinking only about what is provided by the state or what is provided by institutional health. There is a lot provided by the community and the family. And Dr. Nusum mentioned that, and it's really important point that we put policies that mobilize the support and help that comes from the family and from the community. And when we think about that, we then think about family caregiving that usually shouldered by women who are in their 40s, 50s, who also have other burdens. They have their employment, they have their own families, and that burden and stress can lead to really negative outcomes for both the person that they are caring for and themselves and their employment kind of participation. So hence there is the economic argument as well at the country level and at the family level. So I would try to expand thinking about health determinants, social determinant of health, to include these very strong two factors of age and gender. So we know that in the region, women remain living alone for longer. We know that widowhood rates is longer among women. They don't remarry, they stay alone. And we know that the whole social structure is changing through urbanization, through migration. And you know that the family is no longer in many cases available. And even when they are available, they're not well equipped to understand the needs of older persons, because this is something new in the region. And I think also Dr. Nusur talked a bit about the workforce and thinking about the workforce and their ability to respond, both in emergency situation, but in usual situations. So, in the examples from Oman and the importance of primary care that Dr. Hulud talked about, we need to talk about primary care in relation to aged care, primary care in relation to picking up and understanding and detecting the need of caregivers and putting interventions early on. We're talking about health intervention, mental health intervention, and physical activities was mentioned as well. One issue that we need to talk about is mental health and depression, and the burden that with it come other adverse outcomes, for example, elder abuse and neglect. And we don't talk often about that in the region because we feel our culture norms does not exist, but the reality that it exists, and it exists in hidden, it's invisible, because people don't know how to seek support, and sometimes the lack of support from the system put pressures on the caregivers to do things that they might not wish to do, or sometimes they don't know how to deal, for example, with cognitive impairment, with dementia, with someone who is refusing to eat or refusing to do what the usual thing because they are going through a certain process. So I need to press again that, health is health for all. And when we think about health and well-being, it's a whole spectrum of health and well-being. So we can think about engagement and participation and the ability of older people to be able to participate in the society. And in the WHO slides Dr. Rashdan shared, we talk about age-friendly communities, which is a very important aspect, but we don't talk about only the infrastructure. So the infrastructure is very important, but also the ability and the opportunities for people to have initiatives and activities that are useful for them. So we know that some countries actually are paying attention to the issue of aging. So I'm glad to share some of the examples. And we see these initiatives happening at the different levels. So at the macro level of the legal systems and policies, into the meso level, if, for example, training geriatric doctors and nurses, and also to the community macro level. So we see a lot of initiatives, particularly in emergency situations. So we see, for example, examples in Syria, where the community help each other. So when you find trained doctors try to help older people, because they are usually the ones left behind. So we know that the most able will try to travel and leave and seek refuge somewhere else. But who remains in the disaster zone are usually those who can't do it, who are usually older persons or people with disabilities. So we've seen some of these community activities. In terms of laws, so we know that Egypt has passed the elderly care law in 2024, which has a recognition, for example, of abuse, criminalizing abuse, or establishing hotlines. There is some initiatives to look at community-based home care, because we see this happening in the region, but happening organically. We don't see systematic regulation or standards for the qualification or standards for establishing services that are specific for older people. So we need that to be mobilized, because that's helped the economy as well. That helps creating jobs. We know that the region have a high percentage of female unemployment rate, but also that gives security to the family and safety to the older person. So the family often say, I wish I know how to help my parents while maintaining my job. So if there are regulated services that are quality assured, they will be happy to use these services. We know that we have in Tunisia, they are drafting a code on older persons. They are taking a strategy that is based on rights-based and age-sensitive health planning. In Saudi Arabia, we're seeing quite a few initiatives and recognition, and in Oman as well. There was the age strategy, there was the social development strategy a few years ago, which had a chapter on aging. So that's a very good advanced position. And we've seen a lot of NGOs, particularly Alzheimer's Society, which is doing some training initiatives, some awareness raising about dementia and condition. But I also want to say something about increased equity when we think about initiatives to support the health system, particularly when we think about technology and how we provide care, things like virtual wards or virtual doctors. And we think about how that would impact older people in a differential way. So we need to think about whether any new initiatives would increase equity or decrease it. And of course, we want to make sure that we up the digital literacy among different groups. And I like Dr. Sousan, what she said, that there are variations across the countries. And of course, there are variations within countries, and that we see that across the countries in the region in terms of what's happening in rural communities, what's happening in urban communities, what are the resources that you can rely on. So focusing on both ends in terms of thinking about the life course and thinking about older people and thinking about the gender dimension, and also thinking about health and well-being as a broader concept that includes, disease-free years, but also the well-being aspect, so participation and engagement and lifelong learning. And Lebanon is a really good example. For example, you've got the University of Seniors, which is a fantastic initiative where older people can join classes, and they don't have to have a degree or a certificate, but they have the ability to engage and use their intellectual ability.
Dr. Hussein, thank you so much. We'll come back to you with some questions, but this is wonderful. Thank you.